We're here today to discuss one of the greatest threats, not just to the well-being of our families and the prosperity of our businesses, but to the very foundation of our economy. And that's the exploding costs of healthcare in America today. Even for folks who are weathering this economic storm and have healthcare right now, all it takes is one stroke of bad luck, an accident or an illness, a divorce, a lost job, to become one of the nearly 46 million uninsured, or the millions who have health care but really can't afford what they've got. So it's not going to be easy, and there are going to be false starts and setbacks and mistakes along the way, but I'm confident if we come together and work together, we will finally achieve what generations of Americans have fought for and fulfill the promise of health care in our time. And what a remarkable achievement that would be. So, let's get to work. Thank you.
Hello everyone, I'm Lou Barreto. The healthcare debate is a hot political issue every 4 years. But once the game starts, who's willing to make the big tackle? Who's willing to hit the big shot in the fourth quarter? And who's willing to put their political career on the line for the betterment of the country? Recently, I talked to a variety of professionals and students on their thoughts on the healthcare crisis.
Pre-existing conditions to take care of the 47 million people in this country who have no coverage at all. There is no plan, and that's what I meant when I said the Republican plan really is don't get sick, and if you do get sick, die quickly.
Government, its sole purpose is to assist the people, be there for the people, by the people. So government should be, it was something that's health, people's lives, and basically it's a matter of life and death. Government should be involved to support, to help, to be there as an assistance for people for healthcare. Because what is one thing there's not a lot of things more important than healthcare, and being healthy and having insurance, or being provided, to being cared for or treated. So I think government should be there to provide, to support, to assist.
I do believe that government should be involved in healthcare, and the reason being is because there are millions of people who cannot afford healthcare. And without government intervention, they just are limited to free clinics, going and having services done, and then receiving a bill that they cannot pay. And because of those type of things, the hospitals have to increase prices and costs to people that can pay and people that do have insurance. So some sort of government intervention or some sort of government connection would definitely benefit those who cannot afford public health care.
Something terrible is happening.
Something terrible is happening.
Something terrible is happening.
Something terrible is happening.
Health insurance executives are getting a bad rap.
We need to remember who the real victims are.
Health insurance executives.
People are saying a lot of mean things about health insurance companies and their executives. And it's got to stop.
These great businessmen are American heroes.
Please, doctor, my daughter's dying. She needs medication.
Think about somebody else for once.
If my kid falls off his bike and breaks his leg, he should have to pay that money out of pocket, out of his allowance.
How else is he going to learn not to fall off that bike?
And insurance companies are detail-oriented enough to deny claims for things like typos. If you spell something wrong, do you really deserve surgery? I don't think so.
And the public option would make insurance companies lower their prices and give better service in order to compete.
What's so American about competition?
But health insurance companies are huge.
They need to make big profits so they can afford to give their employees health insurance.
Believe me, that stuff's not cheap.
It makes sense.
Insurance company CEOs have a right to their American dream.
And it's 5 houses,
a private plane,
$500 million in your pocket,
and a mini zoo in your backyard for exotic animals like a white tiger and pygmy horses.
Insurance companies offer you variety.
I feel like the government should have some sort of involvement in healthcare if persons can't provide it for themselves. If the person can provide their own healthcare and their income allows them to buy their own healthcare, then absolutely go for it. But
there should be some sort of solidified option in place for people to get health care from the government if they cannot afford to do so on their own yearly income.
How much?
What kind of down payment? 30%. $75,000.
$75,000 to put my son's name
Our
on
son
the
is
list.
upstairs dying, and all you can do is sit here and talk about money.
I think the government should be involved in health insurance, because say it was controlled by if it was like a laissez-faire and like we just let like individual companies own it, it's like it won't be fair for everyone. Everybody won't be able to get equal rights like to health insurance. Like whoever has more money will be able to get the better insurance. If the government interferes, they can make sure that everybody gets equal opportunities to get health insurance.
America.
No. Well, the military has a different health system than the rest of Americans.
It's a public system, though.
Yeah, they don't have an option. They're all in military health care.
Why don't we go with that then?
I don't know. Is military health care really what you... Well, first of all, it's expensive. I think they deserve it, the military. I'm not sure...
But the American public do not.
No, the American public do not deserve the same quality health care soldiers fighting in Iraq and Afghanistan deserve, and they need all kinds of things that the rest of us don't need.
Well, no, they can have the level of care, but are you saying that the American public shouldn't have access to the same quality health care that we give to our better citizens?
Yes. To our soldiers? Absolutely. American public...
Really?
I think one thing, if you become a soldier, you deserve... No, they don't have as nice houses, John. Maybe you're not aware of that. They get paid less. They get paid less. So one of the ways we make it up to the soldiers is and since they're risking their lives, we give them first-class health care. The rest of us can go out and buy insurance.
So you just said...
As 90% of us have. As 90% of us have.
I just want to get this on record. Bill Kristol just said that the government can run a first-class health care system. And that a government-run health care system is better than the private health care system.
I don't know if it's better. I don't know if it's better.
No, you just said it was better.
I don't know if it's better all
No, you said it was better. You said it's the best.
The military
it's a little more expensive, but it's better.
The military need different kinds of health care from the rest of us.
I just want to get this down.
Write that down.
The government runs the best health care.
I will support you in arguing for better health care for the military if they're in any way being deprived of it.
I understand that. So what you are suggesting is that the government could run the best health care system for Americans, but it's a little too costly, so we should have the insurance company health care.
No, what I'm suggesting is our soldiers deserve better health care than the rest of us because they're risking their lives.
I agree
with you. But they're not in the same situation as all the rest of us.
They have the best government-run health care money can buy.
That could be. I hope they do. I'm not sure the VA, for example, which is another government agency, has the best health care. I'm not sure Medicaid and Medicare, which are government programs, provide the absolute best health care.
All right, so